Preterm labor is really any labor which occurs before 37 weeks of gestation. Labor is defined as contractions along with dilation of your cervix. If you find that you're contracting significantly prior to 37 weeks, and the usual interventions of drinking plenty of water and resting fail to reduce or eliminate the contractions, it is best that you go to labor and delivery for further evaluation. Patients found to be in preterm labor are often treated with medications to try to stop their contractions and may require admission to the hospital for IV medications. For patients at risk of delivering early, steroids are usually recommended to help with the baby's lungs, and antibiotics are given as infection is more common in infants prior to 37 weeks. Contractions are the usual main sign of preterm labor, but contractions along with increased thick vaginal discharge, blood in the discharge, increased pelvic pressure with contractions, or watery discharge may be signs that the cervix is dilating. Any unrelenting symptoms of preterm labor should be taken seriously, and we recommend that our patients go to labor and delivery for further evaluation if there's any concern about possible preterm labor.